A new COVID variant taking hold in the Northeast just in time for those New Year's celebrations.
So here to answer your questions is Dr. Shira Daron, the hospital epidemiologist at Tufts Medical Center. Dr. Daron, always good to see you. Thanks for being with us.
Good to be with you.
Well, the latest CDC data shows the variant called XBB now accounts for just more than half the cases in our region. It seems like this variant may be more easily spread, but what do we really know about its severity?
Well, the good news, and there is some good news, is that we have not seen a variant or subvariant yet that is more severe since the arrival of Omicron over a year ago, which was, if anything, less severe.
Okay, so that's the silver lining.
Yeah.
And also, this is also good. Since the start of the pandemic, we've accumulated a number of tools, right? Weapons to fight the virus. So do we have a sense of how well those will work against this variant?
Yeah, when we're looking at any variant, and this one has been around since at least October, so it's not new. We are looking to see if it causes false negative tests. It doesn't. If it makes antivirals like Paxlovid not work, it doesn't. If it makes monoclonal antibodies, which we use for treatment and prevention, not work, it does. And if it evades immunity from vaccines and prior infection. Now it does, but like all of the other subvariants of Omicron, although infection can still occur after vaccination or after an infection, immunity protects against severe disease.
Okay. And we know that next week, the United States will start requiring a negative COVID test for those flying in from China. That country right now is in the grips of another severe outbreak. What do you make of all of this and, the decision to get folks tested who are driving in or flying in from there?
So we're always on the lookout for a new variant that could be Omicron-like in its effect, causing a massive wave of infection and hospitalization like we had a year ago. Now, luckily, nothing has even come close over the past year. And what we know of the currently circulating variants in China is not terribly concerning for that. There's plenty of COVID everywhere in the world for a new variant to arise from. So I'm not sure if China is necessarily where it would arise. And I don't think that requiring a negative test for travel from China will make any difference whatsoever. But what I do like is the plan to expand the voluntary traveler-based genomic surveillance program, which collects anonymized swabs from returning travelers on arrival to monitor for variants.
Great point.
Okay, yeah, well, so obviously this is the season of gathering. New Year's coming up. It's supposed to rain. People likely to be inside. We have this new-ish variant, as you say, and these concerns. Should this be changing the way people celebrate? Would you change the way you celebrate?
I wouldn't at all. I trust my vaccines to keep me safe. I'm not trying to avoid respiratory viruses at all costs. That's not the stage of the pandemic that we're in. Cases are higher now than they were in early November, but we've had highs and lows like this several times over the past year, and I would call it manageable at this time. People who are very high risk, they might well make different decisions about their willingness to do normal things, and that's fine too.
All right, Dr. Shira Daron, we always appreciate your insight. Thank you so much.
Happy New Year.
Yeah.